We are a year into the pandemic, and healthcare workers are still pulling very long hours and exposing themselves to the virus each and every day on the job. So what better way to discuss the very important role that they're playing than on National Doctors Day, which happens to be today. And joining us live this afternoon is Dr. Samuel Pope, the medical director of medical ICU for Hartford Hospital. Dr. Pope, thank you very much for being with us today. And thank you for your service from all of us here at Channel 3 to you and all of your colleagues.
Thank you for having me, and thank you from all of us.
Let me ask you, how has this pandemic, obviously no one could even have imagined what would happen, but how has it impacted your profession and your day-to-day duties that you have?
It's been rather dramatic. I would say it was much worse last spring when we had our initial surge, that we morphed the hospital in ways I would have never imagined working through, just with the number of people who were sick, the number of people who were ventilated. And we still had a fairly large surge in the midst of December, after Thanksgiving into January. But we do have things under much better control now.
When you hear the number now over 5% again with our positivity rate, is that frustrating and also frightening to you?
It is. I am still very hopeful. I will say that the people we've seen come into the hospital now who are sick is definitely a different demographic. We are not seeing our vaccinated, over 65, over 75 populace. The people who are very ill who are coming in are mostly younger. And so it gives me hope that the vaccine really is going to end this once and for all.
Yeah, everyone certainly hoping for that. All kinds of new safety measures, I would imagine, have been put into play over the past year. Anything stand out as something that's really benefited you and your colleagues as doctors?
I've been very encouraged by how quickly we responded and what we've done. And we engaged in a lot of different control measures. I do think that all of the PPE we utilized, I know worked very well. None of my colleagues, my pulmonary critical care colleagues, caught COVID from our exposures at the hospital, which were quite considerable. We did have staff catch COVID, some of our advanced practitioners, residents, and nurses, but we could not detect anyone who caught it from a patient. So anybody who had caught it from an exposure they had to a patient, and for the most part, we gave it to each other or we caught it outside the walls of the hospital.
Lastly, I would imagine it's been very, very hard. You're a doctor and you have a job to do, but you're also a human. And to see what families are going through and what your colleagues have been going through, I would imagine that has been a very, very difficult thing over the past year.
Yeah, I absolutely feel for my colleagues, and that's not just physicians, that's everyone who's been involved in the direct care of these patients. We've definitely seen things that we will hopefully never see again in our careers, and things that I personally am ready to let go and move on, like most people. But it's been quite rotten, I will say at times, but also very hopeful. I think that, the fact that we've gotten these vaccines built very quickly and into the public space in numbers that we've seen is really akin to some monumental human achievement. And I am very hopeful that that's going to be the thing that ultimately ends this. And we did that, human beings, ended a pandemic that, unfortunately was thrust on us. And we responded, I feel, very well.
Well, that is good. A positive note right there, Dr. Samuel Pope. Thank you very much for joining us this afternoon. And again, thank you for all that you are doing and all of your colleagues there at Hartford Hospital.
Thank you so much.